Well, Andrew, what we're talking about here is a battle between drug companies and insurance companies, with patients caught in the middle, paying more for medicine than many of them can afford. Some forced to go off their medication with life-threatening consequences.
I was diagnosed with a bleeding disorder, first one in my family, after my daughter was born.
For years, Maria Shoemaker of Vandergrift has gotten regular treatments for von Willebrand disease, which affects about 3 million Americans. It requires infusions of a hormone that increases the amount of blood clotting factor. Her medicine is expensive, about $10,000 per dose. The drug company has covered most of the cost, and until last year, those contributions counted toward her deductible. She had to pay only a couple $100s per year. But then last year, her husband's employer, which is self-insured, said those contributions could no longer apply to her deductible.
They would have taken the full $20,000 that was offered by the drug company for copay assistance, but I would have still been on the hook for the deductible and the out-of-pocket full. Not a penny of the $20,000 would have counted towards that,
leaving her with $12,000 in medical bills. Maria's family could not afford to cover prescriptions for herself and 2 of her children, who also have blood disorders. She and her husband considered getting divorced so she could go on Medicaid. Instead, she decided to go off her medicine. You basically rolled the dice.
I rolled the dice. I had to. I couldn't afford it.
What did that feel like?
Terrifying.
Maria was dealing with what's called a Copay Accumulator. It forces patients to pay their full deductible and out-of-pocket costs, usually around $10,000 a year, no matter if the treatment is covered by a drug maker or, in some cases, even a charity.
This is not specifically against drug companies. I could go do a huge fundraiser and try to get the money, and I could pay for my medicine, but not a penny would count towards my deductible or out of pocket.
The AIDS Institute, which tracks copay accumulators, says Maria's case is not unusual.
We have seen instances where even assistance from a charity is not counted on that enrollee's behalf, and they're still left with these high bills.
So in essence, the insurance company is getting paid twice then.
Correct.
Pharmacist Chris Antipas, who heads the State Pharmacy Association, says insurers and employers are using copay accumulators to cut down on healthcare costs, but patients with complex diseases are paying the price.
Everybody's broke, basically, and you've got middlemen that are sucking up a lot of money. In some cases, the patient doesn't get the prescription filled because they can't afford it.
A study by the AIDS Institute found 12 of 14 Pennsylvania insurers that provide coverage under the Affordable Care Act, including Highmark and UPMC, have copay accumulator programs. Because so many insurers have these policies, the AIDS Institute gives Pennsylvania an F rating. A Highmark spokesperson says its program aims to give everyone on an eligible medication a set lower price for their medicine, no matter their benefit structure. UPMC Health Plan did not respond to requests for comment. In a statement, the president of the Insurance Federation of Pennsylvania says copay accumulators are essential to keep health care sustainable and affordable, and efforts to prohibit them would primarily benefit drug companies by inflating their profits while burdening all members with higher premiums. Maria says her husband found a new job with an insurance plan that, for now, does not have copay accumulators. This copayment issue was so serious, your husband left his job.
Yes.
19 states, including West Virginia, have laws banning copay accumulators. A bill in Pennsylvania would do the same, ensuring that contributions for prescription drugs count toward insurance deductibles.
So it doesn't matter if it's GoFundMe, your grandmother, a pharmaceutical manufacturer, or some other foundation. It should count. I mean, the money, they're still getting the money. It should count towards your deductible.
But the legislation has been stuck in committee, meaning thousands of Pennsylvanians could be forced to gamble on their health.
If I totally went off of that drug, I would say I would probably not be here within, I would say, most 3 years.
I'm going to go investigate a little more.
Now, last year, a federal judge struck down the rule that allows copay accumulators. So why are they still around? Well, that same judge said it was up to the federal Centers for Medicare and Medicaid to rewrite the rule. And a spokesperson for that agency tells me they are still working on it. We'll keep you posted on any changes. Reporting live in Cashel, Shannon, Paul Van Osdol, Pittsburgh's Action News 4.